Every 2 seconds, someone somewhere in the world experiences a stroke, and 1 out of every 6 people will have one at some point in their lives. Strokes deprive brain cells of oxygen and are one of the most common causes of death and a leading cause of preventable disability. When someone experiences a stroke, quick medical care is critical and can often help avoid permanent brain damage. But what causes strokes in the first place, and what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of the oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply the front of the brain, and vertebral arteries supply the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is interrupted, oxygen delivery stops and brain cells die. There are 2 ways this can happen. Hemorrhagic strokes are when a perforated vessel allows blood to leak out. But the more common type is the ischemic stroke, when a clot blocks a vessel and brings blood flow to a halt. Where do these clots come from? On rare occasions, a sudden change in heart rhythm prevents the upper chambers of the heart from contracting normally. This slows down blood flow, allowing platelets, clotting factors, and fibrin to stick together. The clot can be carried up towards the arteries and blood vessels supplying the brain, until it gets to one it can't squeeze through. This is called an embolism, and it cuts off the oxygen supply to all the cells downstream. The brain doesn't have pain receptors, so you can't feel the blockage itself. But oxygen deprivation slows brain function and can have sudden, noticeable effects. For example, if the affected area is responsible for speech, an individual's words may be slurred. If the stroke affects a part of the brain that controls muscle movement, it can cause weakness, often just on one side of the body. When this happens, the body will immediately try to compensate by diverting blood flow to the affected area, but this isn't a perfect solution. Eventually, the oxygen-deprived cells will start to die, leading to brain damage that may be severe or permanent. That's why it's important to get medical care as fast as possible. The first line of treatment is an intravenous medication called tissue plasminogen activator, which can break up the blood clot and allow blood to flow again in the compromised artery. If it's delivered within a few hours, this medication greatly increases the chance of surviving the stroke and avoiding permanent consequences. If tissue plasminogen activator cannot be given because the patient is on certain medications, has history of major bleeding, or the clot is particularly large, doctors can perform a procedure called an endovascular thrombectomy. Using a fluorescent dye that illuminates the blood vessels under a strong X-ray, the physician inserts a long, thin, flexible tube called a catheter into an artery in the leg and maneuvers it all the way to the blockage. A retriever is passed through this catheter. It expands and anchors into the clot when it's just past it. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out fast if someone is having a stroke. So how can you tell? Here are 3 quick things to try. 1. Ask the person to smile. A crooked mouth or facial drooping can indicate muscle weakness. 2. Ask them to raise their arms. If one drifts downward, that arm weakness is also a sign of a stroke. 3. Ask them to repeat a simple word or phrase. If their speech sounds slurred or strange, it could mean that the language area of their brain is oxygen deprived. This is sometimes called the FAST test, and the T stands for time. If you see any of those signs, call emergency services right away. Lives may depend on it. We're on a nonprofit mission to revolutionize education. Click here to learn how you can get involved.
Stroke impacts the brain, and the brain controls our behavior and emotions.
You or your loved one may experience feelings of
Irritability, forgetfulness, carelessness, or confusion. Feelings of anger, anxiety, or depression are also common.
So, magandang hapon po, sir. Ako nga po pala si Hazel May Conde, ang student nurse po ngayon. Ako po ang mag-a-assist sa'yo ngayong araw na to hanggang mamayang gabi po. Ano po ang pangalan niyo, sir?
Jerome Cortez po.
Kamusta naman po kayo?
Medyo okay na po.
Alam niyo po ba kung asan kayo, sir?
Sa hospital po.
Alam niyo po ba kung anong araw ngayon, sir?
Tuesday po,
Anong oras po, sir?
2 p.m. na po.
Some of the most common effects of stroke physiological, the patient may experience the muscle weakness, paralysis, stiffness or changes in sensation. Most especially in one side of the body. Listen to the patient thoughts and make sure the patient is supported by you no matter what.
Non-judgmental peer and or family support can be an effective way to support patients with mild depression and anxiety. Encourage communication between your loved one and other stroke survivors.
Each phase of recovery is different. Hearing the stories of others can provide encouragement, understanding, or a light at the end of the tunnel. Connection to stroke survivors can be found through online reading, support group participation, or through stroke-based phone advice line.
Promote creative or stimulating activity.
It is helpful for patients to remember that they can still keep up with old hobbies or learn new skills. Some activities may include coloring pages, crosswords, making music, or other board games, and etc. Patients often feel more self-confident and validated in their abilities when they realize that they can continue to complete simple activities by themselves.
Spend some time in the community.
After a stroke, patient may want to hide from the world, especially if they experiencing anxiety or depression.
Nung Saturday kasi ma'am, may celebration din sa amin, I think. Tapos, alam kong bawal sa akin yung yung pagkain. Pero, siyempre, sino taong hindi magugutom ng gano'n. Kaya kinain ko yung bawal sa akin. Tsaka hindi ko na malayan na sobraan ko po yung pagkain ko ng gano'n. Kaya tumaas yung BP ko at nawalan ng malay. At sinugod ako sa hospital. Paggising ko, hindi ko na maigalaw yung half body ko po. Tsaka parang namamatid tong left arm ko po. Yun po.
Sir, huwag po kayong mawalan ng oxygen kasi madami naman pong paraan para po himaling tayo. Kahit po kailangan po natin ng therapy para po naigalaw po ulit natin sa isang side ng body po natin. Kailangan lang po natin ng step by step para po sa ating katawan. At huwag po tayong mawawalan ng hope dahil nandiyan lang naman po si God na kailangan po ang trust. And madami naman po magaling na stroke patient po na natin. Hindi sila nagigaya nyo po, hindi sila nawawalan ng pag-asa. Kaya nyo rin po na nadararami lagi po nakikita po namin sa'yo, sir. Kaya magpagaling po tayo ng mabuti, sir, at na ano po namin sa activities nyo na sabi po ng therapist nyo, sir, na you're doing good naman po, sir. So, noon po, sir, Ano po bang mga activities po yung mga ginagawa niyo sa bahay niyo?
Ano po, exercise, ganun po, walking, ganun.
Jogging din po kayo?
Opo. Tsaka pag hapon naman po, pag gusto namin mga magbabanding, o family banding, kanta-kanta, ganun po.
Baka pwede po kayo mag-sample, sir.
Sige po. Ito'y pa rin ang awit ng buhay ko. Hindi po, ganun po.
Wow, ang ganda po pala ng boses niyo. Nagluluto, sir. Nag-garden.
Ano ang ginagawa ko po hapon ng ganun? Tsaka, minsan, naglaro kami ng chess, Scrabble, dama, ganun. Wait lang, pwede katawag, girl.
Ikat mo ko lang ta.
Wait lang,
Eh,
wait lang,
magkakwentuhan mo ako.
ikatawag lang.